Hi, everyone. Welcome to our first episode of Cafe Gray, our new webcast. Here to encourage open-minded thinking and exploring the gray zones of health. So I'm Dr. Garrett Smith, licensed naturopathic physician. My practice is Naturopathic Medicine of Southern Arizona, and my website is nutritionrestored.com. And I'm here with...
Hey there, Dr. Eric Lewis. I am also a naturopathic physician. I'm in practice in Asheville, North Carolina at Lewis Family Natural Health, and I also write for and operate the website hemochromatosis.com.
So we called this webcast Cafe Gray because through my experience with hair mineral analysis, I've kind of become somewhat of an expert in bringing down high tissue calcium or high calcium in the cells, which in the human body, my imagination, my theory on it is that just like in plumbing systems, too much calcium in faucets and fixtures and pipes will basically ruin them over time. And then that's the CA in cafe, and then Eric can tell you a bit about the FE. Go ahead.
FE is the chemical symbol for iron. And this, as we'll see, is a sort of a outgrowth of a personal story of mine when I found out that I have a genetic predisposition towards high iron. And iron itself, just like calcium in systems, can build up. We often hear of iron deficiency, but iron overload is a very common problem as well too. And as Garrett and I will talk to you about, there's a lot of problems that are very analogous to rusting from high iron. So thus the iron aspect of the webcast.
Yeah, so with all our fancy things today, technology and all that stuff, we're still having problems with calcium in things and machines rusting. So that's kind of how we came to this. And the gray zones of health, a big thing that Eric and I will always harp on is that too many people out in the health world, or any world or industry out there these days, they want things to be very black and white. And the big thing that Eric and I agree on is that almost nothing is black and white. Everything is in a gray zone, and everything has to have context, and everything has to fit for the person and the situation. And so when people want, is iron good for me or bad for me? Well, not enough iron is bad for you, too much is bad for you. Same thing with calcium. Not enough is bad for you, too much can be bad for you. They can all be bad. Too much of anything is bad, too little of anything is bad. But with calcium and iron, these things can really be overdone, particularly with some of the things we've done in our modern nutritional theories and approaches. So the big thing actually we wanted to go over today was just kind of our backgrounds and how we came to working on the things that we're working on, how Eric and I kind of came back together. We actually did attend the same naturopathic medical school. He was a year behind me.
Yeah.
And we weren't friends per se in medical school. I'm sure we saw each other. I know I saw him in the halls.
Yeah, we crossed
didn't really ever. Yeah, we didn't really ever chat much. And then later he ended up he reviewed my book, Solving the Paleo Equation, and then later he sent me his book on holistic health for hemochromatosis. And then after I read his book, I knew I just had to talk to him, and then we came to this today. So I'll just head back a little bit I'll try to make my background quick.
Good luck.
Who knows? Anyway, so my dad was a dentist, so I've always kind of been thinking about the medical field, but I knew I didn't want to become a dentist because actually one day my dad came home. My dad was a great dentist, amazing. People called him at his funeral. He died of metastatic prostate cancer. Which could be related to his job, but that's a whole nother story. He came home one day and told me, he said, you'll never know what it's like to be trying to do your best work for somebody and have them in the chair looking up at you and saying, I hate seeing you more than anyone else in the world. And I thought, that's one thing I don't ever want to be doing. So anyway, I was into fitness, and I started weight training with 5-pound dumbbells in my room at age 11. So I got into fitness, Fitness led eventually got into bodybuilding ideas and stuff like that. Fitness led to nutrition. Got my degree in physiology at the U of A with a minor in nutrition. And so then I worked in a supplement store. As I was working in a supplement store, I found out about naturopathic medical school, and it was kind of all the medicine and all the stuff I like to do on myself. And I could be in Arizona, I could be a licensed physician, do real medicine. And so that led into that. And then in my practice, as I kind of went through my phases, all doctors go through phases where they think that they found the next thing that's going to fix the world. Eric, you agree?
Haven't we all?
Yes. So
the theory of everything.
Yes, the theory. So personal trainers go through phases. If you've ever had a personal trainer or known them, you'll know they go through phases. Doctors go through phases. Everybody goes through phases. Let's see, I went through my heavy metals phase where I thought that everything was that. I went through my gut healing obsession phase. I went through the paleo diet's going to fix everything phase. I went through the, the candida phase. Everybody has to go through a candida phase. What else? So those were the big ones. Oh, I went through the raw diet phase. And when I say raw diet, most people think raw vegan diet. I was actually doing the raw meat and raw milk and raw eggs and all of that phase that people still talk about me from medical school doing that stuff.
You were well known in the hallways for that.
I was infamous for that.
Infamous,
and
exactly.
The primal diet, the Agenus von der Planet's primal diet, that was what I was doing. But anyway, went through a bunch of fitness phases, did Olympic weightlifting, powerlifting, Highland Games, bodybuilding. Now I'm in the most comfortable phase of my fitness thing in my life, which is body weight and strength training, and I think this is going to last a long time. I just did an original strength workshop just this last weekend. I'll talk about that more in future webcasts, but that's an amazing, amazing thing. But those are the big, so later I got into my current phase, which has actually been, I will be honest, this has been the longest phase I've ever been in, and I really don't see it changing, only adding to it and evolving it, which is the hair mineral analysis phase, which for those of you who don't know, take a small sample of hair, lab analyzes it. For the lab we use looks at 36 different minerals in it, the levels of them in the hair, and my job, my passion is to figure out what those minerals are saying about what a person needs more of, what they need less of, what we need to get rid of, what we need to add more to, and helping people to feel better, because minerals are the foundation of everything that we are. You didn't learn the periodic table in high school because it wasn't important. It's the foundation of everything that we are. And iron was the big missing piece in hair analysis, because I'm actually very much of the opinion that hair analysis is not useful for iron, mainly because we have so many proteins, storage proteins, ferritin, transferrin, all these things that can hide iron within the system. So it doesn't show up on a hair test very well unless it's really high, and then we know there's an iron overload problem, but low or lowish iron doesn't really show us anything. So when I came across Eric's stuff and he was talking about iron overload, and I recognized some of my people in the descriptions in his book, that's where I knew I came across like a major missing piece of what I was doing, and I could really add a lot to what I was doing. So I think I covered my stuff pretty good. So Eric, your turn.
Yeah, and absolutely. And actually, just to piggyback off what you just said at the very end, is that iron is a well-kept secret, so to speak. The body likes to hide it. It's critical for our functionality, but in excess, it can be toxic. And so the body does a very good job of hiding that. And we'll talk about how in so many people out there, especially people whose genetic heritage goes back to Europe, in northwestern Europe, so many of these people are affected by this condition in particular, or conditions related to it. Yet there's very little awareness of the situation, but we'll get to all that.
We're trying to change that.
We're trying to change that, and that's part of why we're doing this webcast. So my background, some similarities, I guess, growing up, I was also into athletics, and weightlifting and weight training, and in college I was a sprinter and a jumper on our track team, and always had an eye towards health and fitness. It wasn't particularly the healthiest child. I was always suffering from things like asthma, allergies. My skin was a mess. I had eczema pretty badly. Had to do all sorts of conventional creams and inhalers and allergy shots and all that type of stuff, and never really found any solutions to that. But as I started to get older and on into my college years, I started to transition this interest in athletics and performance into understanding health in the human body. And so that led to a lot of reading, and actually did some work as a massage therapist after I got out of college, and worked with a few NFL athletes. I was living in Atlanta at the time, worked on some of the Falcons, worked on some professional track athletes, and wanted to use that to segue into maybe a career in physical therapy. I thought about chiropractic, I thought about acupuncture school, and one day just came across a book that described that there was this program that sort of combined all of these concepts with nutrition and herbal medicine, all wrapped up in a nice holistic package as naturopathic medicine. So that was sort of the moment that the light bulb went off and said, oh, we can use all these different elements to treat an individual person. We can figure out what is going on, what is at the root of their health issue, and we can put it all together. And so that was sort of what led me to naturopathic medicine. And been out here in Asheville, North Carolina for going on over 10 years here. And my wife and I are in practice together. A bit of a general practice. We see a little bit of everything. See a lot of issues with hormone imbalance, metabolism. If Garrett is looking at minerals and the balance within to be one of the key elements to health, I would say that one of the main areas that I focus on is metabolism and metabolic efficiency, and how the body at the cellular level is making and producing energy. Now, as we'll share as we go on, too much or too little iron, too much or too little calcium or other nutrients can really mess up the body's ability to make energy properly. So yeah, and just over the years, doing a lot of reading of Garrett's work and sort of seeing how he worked with his patients from a bit of a distance, started to realize that a lot of the concepts and the topics that he was covering honestly ran quite counter to what we were taught in medical school. A lot of the things that we talk about with our patients run counter to some of the dominant ideas, whether you're talking not just in conventional medicine, but also in holistic medicine. You go to the health food store and talk to the health food store clerk, or your nutritionist or dietitian or personal trainer. Everyone's got these ideas about what leads to health. And like Garrett was saying at the beginning of the webcast, is that usually it's presented as this or that. It is black or it is white, and this is what you should do for your diet, this is what you should do for your exercise, and this is what worked for me. No, that's not how it works in reality. That's not what people's experience are. I mean, I'm sure, Garrett, you've experienced like we have in our practice, countless people are, and I'm doing air quotes here, doing all the right things. They're eating how they should eat, they're exercising how they should eat, and say they're not losing weight, or they're not feeling better, or their sleep is a mess, and there's just a lot of, well, gosh, I'm trying my hardest, what am I doing wrong? So that's kind of what I would like to talk about is, where are we sort of misunderstanding health? What are we missing? Maybe where do we place emphasis where we shouldn't necessarily place emphasis upon, really talk about what it is that we can do to identify what the problems are and how we can go about fixing them so that we can just perform better.
Yeah, no, absolutely. I have things that I'm gonna put out in a blog post or maybe a video of my own, what I call roadblocks to the whole thing, where it's like you were talking about somebody who's doing everything right. Like they've had, let's say they got health problems and they've been reading up and they're trying to do everything right. They're eating well, they're taking, certain supplements as needed for their system, and they seem to react to everything, and everything seems to make them worse. And then I go, this is a common thing. I'll go, well, this sounds like you have probably a mold problem in your house, like, because this is the reaction that I see when people have a mold problem. And I'm like, I can't fix a mold problem.
I talked to someone yesterday about this exact thing. It's a perfect example. Happens all the time.
So, but they seem to react badly to almost everything you try with them, right?
Sure.
Yeah. I've started to, I've got one of the things, actually, this may be you too. What I'm really good at is recognizing patterns.
Mm-hmm.
And you just see these things happen over and over again, and then a good practitioner will say, what's the commonality here, and what am I doing? And if it's a good pattern, right, you want to do more of it.
Sure.
And if it's a bad pattern, you do not want to do the definition of insanity, right, which is doing the same thing over and over again and expecting different results. So if the approach, but it might just be one person who, like as an example on hair testing, Eric's going to go over lots of statistics with iron genes, but one statistic on hair testing that's just an example is about 85% of people come up with high calcium on hair testing. So when people are listening to me on this podcast and I'm talking about the problems of calcium, most of the time I'm going to be talking about high calcium problems because that's most people.
Mm-hmm.
But should we do the same things that we do for high calcium people for low calcium people? Obviously not, but people listening to me might say, oh, well, he talks about fatigue with high calcium. I'm tired, I must have high calcium. No. How many things can make people tired, right? It's not just one thing. Go ahead, you were about to say something.
Well, it's just ironic, to say that because, everyone associates iron deficiency anemia or low iron with fatigue, but one of the most prominent symptoms of high iron is also fatigue. So yeah, just because you experience one symptom doesn't mean that therefore this is what it is. However, right, like you're saying, patterns exist all over the place. And once we can identify what these more common patterns are, that's maybe a starting point. But yeah, let's not forget the individuality of our makeup and our environment and our lifestyle and how that impacts our health.
Yeah, I was just thinking of one guy. He was doing my program. He was feeling better, and then all of a sudden he's like, gosh, I've been feeling so much worse in these past couple of weeks. I don't know what it is. Finally, after some questioning and all this stuff, he had added like bike commuting. So all of a sudden he was like commuting on his bike 10 more miles a day, and he added the walking, and it was like, oh, you're just not eating enough.
Yeah.
And you added all this activity. So it's like, could too much exercise be the cause of somebody's fatigue? Sure.
Yeah.
So this is like the gray zone that this whole show is going to be based on. Is it's not black and white. Like, just because somebody's tired doesn't mean like it's a repeat metabolic mess up. They might just, they might be not, and if all of a sudden they tell you, well, I only sleep 2 hours a night, and then you go, well, geez, of course you're tired. Like, I seriously had an adult male in my office. I said, how much sleep do you get a night? He said 3 to 5 hours. And he says, is that not okay? And I was dumbfounded. Like, an adult male did not know that 3 to 5 hours of sleep a night that he was doing by choice was not okay. So this is why we have to, this roadblocks thing that I'm going to get into writing more about. I have a roadblocks article that I send my people about things that will completely impede any progress with me. And these are things that I can't fix. This could be things on people's mouths, root canals, amalgams. This could be mold in their house. These are things that I don't fix. And I'll actually tell people, you need to go get these things fixed before we can do any work of mine, because these will completely impede any progress. And I need to put things like sleep on it. I need to add some of these basic things on it. But those are big things that people don't want to think about. Nobody wants to think about mold in their house, right? Because the expense of that can be outrageous. And I'm not sure that with a lot of modern construction that it can even be totally remedied. But anyway, this is why we're doing this webcast, is because, as you can probably already tell from listening, Eric and I come at this from a very similar viewpoint. We just had different development timelines, and he went into the hemochromatosis because that was a personal problem of his.
Mm-hmm.
I'll be honest, I'm pretty sure I came into hair analysis because, for one, I seem to be very, very sensitive to levels of high calcium just as an individual. And it seems that in my family, the men in my family have a really tough time keeping our magnesium levels up. And so I used to have major blood sugar issues and other things related to magnesium. And so calcium and magnesium are the first two minerals that we show up on the hair test. And that's probably how I got into this, was because I was trying to fix myself. I always tell people I got into medicine because I wanted to fix myself, because I only have one body in this life, right?
Yeah.
It's kind of like, if you want to race cars, it'd be good to know how to fix a car, right? So I only got, this is my body, I better learn how to fix it. And so then I was just kind of good at talking to other people about it, so I got into helping other people. That was how I got into being a personal trainer. I was a personal trainer for 12 years. I was just good at myself exercising, so I got into helping other people exercising. So one of the other things we were going to do on this webcast today, well, Eric, was there anything you wanted to add to what I was talking about?
Well, no, I think a lot of us, whether it's in the naturopathic profession or other, healing professions, a lot of it is a personal story. And, you want to sort of track down what are the reasons why you're feeling the way you're feeling. And it's exciting when you can do that. You can sort of do some detective work and figure things out and make connections and see patterns. But then it's even better when you can identify what are some tangible things that you could do to make your body, your life, your health, your family better. And so It's very rewarding.
Yeah. And then one of the things I think you and I both work on is we're trying to find, for those of you who don't know the analogy, there's a story about a professor who would put, he had a jar in front of the classroom and he would put rocks into it, ask the class if it was full, they'd say yes, and then he'd put in gravel, and the gravel would find the spaces between the rocks, and then he'd ask them if it was full, and they'd say yes, and then he'd put in sand. And so until he got down to the point where you couldn't put any more rocks or sand or gravel or dirt in it, asked him if it was full, they said yes, and then he put in water, and the water was filled in the spaces. So when you hear me on the rest of these webcasts or Eric talking about the big rocks in the jar, I said this to Eric the other day, and he was like, oh yeah, big rocks, because we both know this analogy. We are trying to find the big rocks for the most people, because when we can find the big rocks and we can fix those, that's the big chunks that you can fix. Like if somebody needed the water, like if somebody was at the point where they've fixed their sleep, they've fixed their food, they've fixed their minerals, they either know they have iron overload and they're addressing it, or they don't have an iron problem and they don't need to worry about that. And they've fixed their activity and they've fixed all the big rocks, and they're down to the point of the water. And then it's like, oh, they had some gene that needed a milligram of MTHF a day, and that was the only thing they needed to fix, and that cleaned up all the rest of their problems. That's great. For most people, if we can work on the food and the exercise and the sleep and the minerals, then we get rid of most of the issues. So that's really the big rocks. When you hear us talk about big rocks, this is what we're trying to do. We are trying to fix the big rocks. So Eric, what I wanted to do today was go over what I had Eric do and I did myself, was we picked two of our favorite studies or research papers, kind of from our area of expertise, that we thought were awesome and we wanted to go over. So Eric, since your screen is up, why don't you go over your studies?
Sure, yeah.
Research papers first.
Let me I'm just going to pull this up here. I wanted to highlight a few things out of this, really out of the abstract from this. This is sort of an epidemiological study from back in 2001, and what I want to talk about was just sort of the prevalence of iron overload and sort of the genetic backbone to that. So I'll get into sort of the nitty-gritty in a second. And then later on, when I bring up my second study, I want to talk about a natural remedy that is very accessible, very easy to utilize, yet has a very positive effect on us. So just because we have, a genetic tendency towards one thing, it doesn't mean that that's just sort of set in stone. We can do things in our day-to-day to modify this, and we can really improve upon our health once we figure out what's going on. One thing I'll say before I get a little bit into this is a little bit more of sort of my iron related story, because iron overload and hemochromatosis was not something that I've known for forever. It was something that in school was a test question. And we
one test question.
Yeah, I mean, you always get the one question for your board examination if someone has iron overload, blah, blah, blah. So we knew it in that sense, but really didn't get the sense that it was that big a deal. I mean, what do we focus on? We focus on cardiovascular disease and cancer and diabetes. We focus on, so to speak, the big rocks of health. And yes, that's what affects millions and millions and millions of Americans and people around the world. However, why? Why are we developing these problems? What are the underlying factors that leads to it? And so, when I was doing some of my lab work, I guess at about 5 or 6 years ago at this point, like we had said earlier, athletics is very important, exercise is very important, and all of a sudden both of my knees started hurting for really no real reason. I wasn't particularly doing overuse. There's no injuries, no accidents, no real reason for it, and kind of felt like an old man getting up and out of seats. And here I was at the time, 36 years old, and it's like, man, I'm feeling like 56 or 66 here. What's going on? So just a part of my my blood work that I did on myself, all of a sudden I saw my iron was off the charts high, and other numbers on the blood panel, my ferritin level was elevated, my transferrin saturation, all these markers having to do with iron storage in the body were elevated. And my wife, who like I said is also a naturopathic doctor, we looked at one another and we said, could this be hemochromatosis? Like, that's very interesting. Another thing that was kind of ironic at the time was that very close in time to that, I sat down to dinner and I had some brisket one night. And I grew up in Texas, and so brisket is part of our state culture in Texas. We love our barbecue. And I looked at it and I had no interest in it. And I was wondering what was wrong with me, then it sort of added up. I was like, oh, my body is becoming overloaded in iron. I therefore didn't crave that which had very high iron. So it was a very palpable, tangible experience. So went on from there just to research it, and frankly, there's very little out there. Millions and millions of Americans, Canadians, folks from the UK and Ireland, Australians, South Africans, people around the world, millions of people have this genetic predisposition towards high iron. And so when you look into the genetics, and I'll bring it back to this study here, is that one thing I'll sort of highlight with my cursor here is that 1996 was when this gene was found, HFE, and that literally means high iron. So H for high and FE for iron. HFE gene was coded in 1996. Now, people had observed the symptoms characteristic of hemochromatosis going back 100 plus years, but in 1996 we finally found the gene for it. And so there's several genes that are most commonly related to iron overload. I'll highlight this one right here, the C282Y. That's the one that gets the majority of the attention. It's another one called H63D right here. So what I've highlighted here, homozygosity, what does that mean? That means that in the base pairs there are alleles, and when these alleles mutate or switch from their ancestral form, that can lead to changes in our DNA structure, and DNA leads to the coding of proteins and drives expression of enzyme systems and so forth. So homozygosity means that there are two changes in that particular gene. And so when you look at the majority of the research with iron overload, you'll see C282Y homozygous come up all over the place. And when you look at the textbooks, when you ask physicians, they will say that to be qualified or diagnosed as hemochromatosis, you have to have 2 mutations of the C282Y gene. Why I pulled the study up is that 52 to 100% of these studies. So some studies basically said, okay, if it's not homozygous C282Y, then it's not hemochromatosis. But some said, no, it's only 52% of the cases. Well, what that means is when I got my lab work, I was actually heterozygous, meaning I had 1 gene mutation for this. Well, here I was with a lot of the symptoms of high iron. Like I said, my knees were bothering me, my joints were aching, I was having difficulty sleeping, I was having fatigue issues, and so I was starting to notice some of the symptoms even though I only had 1 of the 2 mutations. So when you go on to see this review, you'll see that there are different combinations that certain people express, and there is a certain percentage of people with heterozygous or something called compound heterozygous, just mixtures of different genes that when you put these 2 together, you end up with a situation where a person is absolutely affected, their health is absolutely affected by high iron. So part of, we're bringing all this back to the gray zones of health. Sort of the black and white version would be is if you have 2 copies of this, you have it. And if you don't have 2 copies, then you don't have it. End of story. Well, I've talked to a lot of people with hemochromatosis over the last 4 or 5 years, and it's very interesting. I'll see a lot of people with very high levels of iron in their system without these genes. Yeah, I will see some people with these genes with very low iron in the storage form of ferritin. So everyone is different, everyone is unique. You got to look at each situation individually and not make any sort of black or white judgments based on what a person's initial, genetic makeup is. We want to take that as a piece of the puzzle and, then start to get to know the person, the other aspects of their health, and as we'll probably cover in future webcasts, we'll talk about other genetic mutations and how all these things can sort of interplay with one another. So that's a little bit about some of the specifics here. I wanted to
wait, Eric, go back to that one real quick.
Let's go back. Okay,
go back. So what in this study they were those percentages in that part you highlighted?
Yes.
Those are the genetics of people who had been diagnosed with hemochromatosis, with iron overload before they, so is that what they're saying?
Yes. It gets, again, a little bit of gray zone because especially when this study was done in 2001, this was even less understood at the time than it is now. And so one thing that actually kind of aggravates me a little bit is that there is no real standard for what is or for what isn't. It gets confusing. I've had people, send me their lab work and say, well, do I have hemochromatosis or don't I? And, so when they're looking at it in these studies, oftentimes they will take someone with the clinical signs of hemochromatosis, check their labs and say, oh yeah, okay, now that we have your lab results, yes, this is what you have hemochromatosis. Versus sort of the other way of going about it where someone's maybe not expressing symptoms of that, but this testing is done and they find it. And so it's tricky. It's tricky. It's very tricky. And I've had a number of people sort of raise this question, and I don't have the perfect answer for it, to be honest. I personally worry more about how the person is feeling, how it's affecting their life, rather than, what is the proper diagnostic criterion. Because if someone has a mildly elevated ferritin, but it's really affecting the rest of their health, well, that counts big time to me. I've talked to people with massively elevated ferritin that had no idea anything was wrong with them. We should do something for both of those people, but yeah, there's a lot of gray area with this, which is why it's sort of a fascinating condition to study.
Right, right. And so the prevalence, I'm just looking at that one thing, the H6-3D carrier frequency is 22% in the European population. So carrier means they're a heterozygote.
Right.
So European population, I mean, that's more than 1 in 5.
Exactly.
Of people with European heritage are a carrier. They're a heterozygote, so they may not be a super strong expressor of this iron overload trait.
Exactly.
But that's still more than 1 in 5. And I think, what was it? Heterozygotes for C282Y was in the Northern European was either, was it 9% or 11%? I think it was 9%.
It slightly varies based on country. I'll pull this up, which this doesn't really answer your question, but it shows, as you get up closer towards Ireland, the British Isles, you'll see a higher percentage of people. But basically, think 1 in 9, 1 in 10 people are carriers for the C282Y. So that's me. I have one of those two. So that makes it the most common genetic disorder for people that trace back to Europe. It's the most common genetic condition that there is, yet not everyone has heard about this.
So 9% of people, based on that study, 9% of people were heterozygotes carriers for C282Y, and 22% of them were heterozygotes for H6-3D. And then you start to, what I'm doing is I'm just trying to say, then you start looking at the population, and there's so many other genes that could play a role in this, but just these two major genes, 9% and 22%, obviously some of those overlap in the compound heterozygotes, where they have the two genes but only one copy. They're carriers of both.
Right. Yeah. I'll highlight this. The compound heterozygotes, one of each, is like I said, sort of 5% of people diagnosed with hemochromatosis have this compound heterozygote genetic makeup. So yes, it's a fairly common thing.
So when we're talking about, like, this is why I started to think so much about this hemochromatosis thing. Well, a bigger part of it was I have a family member who I figured out was dealing with this based on her 23andMe data, and then I started talking to Eric about it, and Eric's like, oh yeah, we got some things to work on here. So I started looking at those statistics, and I think, so people who are coming to me or Eric are usually coming to us because they're not feeling well.
Exactly.
And then you start to see that 9% is 1 in every 11 people, and 22% is about 1 in every 5. So there's some overlap between those. But anyway, you figure 11%, 1 in every 11 and 1 in every 5, and then you figure who's the population who's coming to us, and then you start going, there has to be a huge part of iron playing a role in why people are coming to me. And I started to think about, I have some people where I do the hair analysis and I'm working on it with them, and we get their hair analysis looking really, really good, and they still have symptoms. So I started, what do? I don't just do the definition of insanity and just say, well, your hair test is good, you're fixed. Not if the person's still saying they have symptoms. So I've always been looking further to expand upon what I do with the hair analysis and the knowledge that I can use on it. And that's where it was really cool. It was very, coincidental that Eric's book came in the mail for me, and I'll be forever grateful that he sent that to me. And then I started reading, and I just saw my family member in there, and I went, oh my gosh, this is like the thing I've been missing from my approach. So anyway, back to you.
Yeah, so the greater point here is that this is an incredibly common issue for a lot of people that most people don't know about. Millions of people are walking around without a clue.
Well, I think let me add, the worst part is their doctors will tell them that they can't have it or they don't have it. So not only do they not know about it, but even if they learn about it, then some of their doctors are telling them, no, you can't have this.
Oh, this is a big issue. Number one, iron is not a standard blood test anymore. It used to be a standard part of basic blood work. They took it off in the late 90s. And so to get, when I see people bring in lab work from their primary care physician, I am shocked when I see an iron panel at this point, because it's so rarely done. And so it's something that can be very easily identified. But then when that does occur, and I say, here are some patterns that look familiar, has your physician ever mentioned this? Oh no, they said that, They were looking at my cholesterol, they were looking at my blood sugar, looking at my hemoglobin A1C, but they didn't really mention the fact that my transferrin saturation was off the chart. What is that? Can you explain that to me? And, then I'll mention this, and then people go back to their doctors and bring it up, and they're like, oh, no, you don't have hemochromatosis because of this, or this. And they're clearly affected by this. And when we do therapeutic steps to improve their iron metabolism in their body and they get better, yeah, that's a major impact on their health.
The proof is in the pudding kind of thing.
Absolutely. Results is at the end of the day what it's all about. And, so the most common therapy, the best therapy, the most recommended therapy is phlebotomy. And oftentimes this is done with the doctor's prescription, and oftentimes it's just simply done via regular blood donation. There are blood center services around the country that do accept people with high iron as donors. It's not contagious. It's not a problem. FDA cleared it back in the 90s. That's perfectly safe to use to help out the community. But phlebotomy donation is a great way to lower that iron. And basically, after my first blood donation, my symptoms improved immensely. My knee pain started to go away. Sleep started to get better. Fatigue started to get better. That was really, sort of a turning point in an aha moment, because it was like, oh, here's the problem. Here's one of the solutions. Here's the result. And so that was definitely sort of key me into, this is something here. So.
Yeah.
So, yeah, I guess the bigger picture is that it's very common, and not many people know about it, and not many physicians know to think much about it. So, like we said, we're trying to change that.
Right.
Any other things that you think to go over?
Sorry. No, I was just going to say we'll go over some of the things that you go over. You'll go over some of the things that can be tested out or used with iron overload in future webcasts.
Sure, absolutely.
So what's the next study you've got going?
Well, I'll click on over here. Let me actually scroll up to the top just to sort of show the paper here back in 2009 from the journal Blood. Curcumin, maybe more commonly known as turmeric. This study was sort of introducing curcumin as something that's been used in cancer prevention. Is also a biologically active iron chelator. Chelator means literally to claw or to grab. So in this context, if the body is overloaded with iron, what are things that can literally go into the body and take this iron out? One of the interesting things about iron, indicating how important it is to normal function, is that there's not a normal method of excretion of iron. We metabolize some in our gut, when we sweat, when we exercise, making new red blood cells. Like there's, a very dynamic nature to iron metabolism in the body, but there's no major method of excretion. We can't just excrete excess of iron. So when a person has become overloaded in iron, we need to do things to lower it down. Phlebotomy is one way, but what are other ways? A lot of people I talk to have a very difficult time with phlebotomy. So what is something else that we can do in correlation with phlebotomy or other medical practices? So curcumin or turmeric is one that's received a lot of attention. It's maybe one of the most well-researched herbs that there is, but one of the reasons why is that it's really effective in lowering iron. So I'm going to come down to a few of the graphics here. I'll start with this one. I'll sort of highlight this picture here. And so the graph in the A panel shows sort of the level of iron in the spleen. And one thing about iron is that when it concentrates in the body, it tends to concentrate in the liver, the spleen, the bone marrow. So in this study, they're looking at the overall level of iron in the spleen. And as you see the dietary curcumin or turmeric increases, that spleen iron decreases. It's a linear relationship. These slides down here, these histological slides that you'll see, the one in the middle, we'll just have to take the researchers' words for this. When you look down here, you actually see a lot of iron deposits inside the cellular structures. But you go over to the one on the right, and this is with both iron and the curcumin or turmeric, you see that it's gone. And it's just a wonderful, clean study on showing sort of a before and an after picture. And when you look at this in real life, I've seen people measure their ferritin, and ferritin is a storage form of iron. It's a good way of monitoring iron load in the body. I've seen people's before, during, and after numbers, and it very reliably decreases. And so it's just another adjunctive way, and one that is just, turmeric is good, not for every situation, of course, but one that is good for many conditions. And if you get more into this paper, you'll see that it not only just chelates iron, but it also fundamentally changes how the body metabolizes iron. Maybe in future webcasts we'll be talking about, how do we absorb iron, how do we block the absorption of iron from our diet. But anyways, turmeric curcumin is one of the best remedies that, and there are several other studies on this. This is not just a one study deal. There are many studies showing that turmeric is a very good way to lower the body's burden of iron. So.
Awesome.
There we have it.
Funny coincidence though, there's all this research out there about curcumin and turmeric helping all sorts of conditions, right?
Mm-hmm. Mm-hmm.
And then I started knowing it, and once I learned that it was an iron chelator, I started going, I wonder how much of curcumin's effect on all this variety of diseases is simply due to the iron effect.
Well, you look at Alzheimer's, Parkinson's, neurologic disease. These are a lot of the conditions that are studied because it affects so many people. I've known a number of people, and some very dear to me, who have passed away recently from Alzheimer's. It's affecting nearly every family. And, so when you look at it from the turmeric side of things, many of the studies on turmeric showing its effectiveness is in improving cognitive parameters or preventing cognitive decline. From the other end of things, there's actually a recent study coming out that ferritin is actually a really good marker of progression with Alzheimer's, even maybe more so than some of the traditional markers like the tau protein and things like that. There's almost a stronger relationship between iron and Alzheimer's than some of the other markers we've traditionally been looking at. So absolutely, maybe some of the benefit of turmeric is because how it's positively modulating our iron metabolism in our body.
So now how Eric and I have talked a lot about how it seems that calcium and iron have a major overlap in the body, especially when they're depositing.
Mm-hmm.
So I went, just while you were talking about that, I was like, let me just see if curcumin has any effect on calcification. And because it would affect both of them most likely.
Sure.
So I just found a study, but it's not the right time for me to read it right now. So
we'll get to that later.
Anyway, we'll get to that later. So am I going to go now? I think I'll go.
Let's do it. Sure. Yeah.
Screens. Okay. So I got my first one ready. So if we want to switch the screen.
Why is my computer being like this? It's being funny.
Oh, I think I can switch it. So we're trying to switch the screen now, everybody.
There we go.
We got it now? You see my screen? Oh, there we go. Okay, so here we go. We got it?
Got it.
Okay, so this is one of my favorite studies because anybody who's out there on the internet looking up health stuff is bound to come across the infamous leaky gut syndrome out there. The cause of everything, right? Your gut is leaking proteins into your blood and it's creating autoimmune and allergies and all this stuff. And if you just fix your leaky gut, your life will be perfect. is the way I get, I'm mocking it a little bit, but it's gotten to that point with leaky gut. I've seen some other people on the other side saying if leaky gut actually existed, you'd be dead because you'd have these gigantic proteins floating around your blood and it just like too much. And then there's other people who think that, everything is related to it. So 1964, this study, the title gives it all away: magnesium and calcium as regulators of intestinal permeability. Leaky gut is intestinal permeability, same term. So I always like when I was looking into this stuff and people would say, well, leaky gut doesn't exist. And I was like, well, it was back in the journals in 1964. So apparently it existed 50 years ago. It was just not widely accepted in mainstream medicine. But so
it existed before bloggers did.
Yes. So let me turn on my highlighter. So what they did was, so this is, they were actually looking at, they had rats, actual rats, anesthetized. And then they would rinse their gut cells with either magnesium or calcium. So if you look down there, I forgot to do this part, a calcium chloride rinse. So I would tend to say, based on what I know about hair analysis now, calcium, high calcium, would make things worse. Calcium produced a permeability. Calcium increased permeability when they rinsed the cells with it. So too much calcium increased intestinal permeability, increased leaky gut. The next sentence, a magnesium chloride rinse, which is funny, magnesium chloride is what I use for a lot of people in their topical. That's what's in, if you have magnesium oil spray, that's magnesium chloride. If you have magnesium lotion, that's typically magnesium chloride. If you make Magahol, that's typically magnesium chloride. We'll talk about Magahol in the future, but a magnesium rinse reinstated normal permeability, fixed the leaky gut that they had induced in these rats' gut cells, okay? So the biggest thing I see on gut healing protocols, everybody's like glutamine and N-acetylglucosamine and probiotics and all this stuff. Here's a funny story. I know a guy, a patient of mine told me about her dad. She was sitting in front of me. We were going over the hair analysis, and she sees all my emphasis on magnesium because I always tell people there's only one thing you learn from me. It's that you probably need more magnesium and you'd probably do really well to supplement it, because you're not going to get enough from food. And if you worked so hard to get enough magnesium from food, there wouldn't be any room to eat anything else. It's just really, really hard, and you can improve the quality of your life by getting more in generally. Obviously, this isn't for everybody, but generally, magnesium is a very good thing. So they're doing all these things to heal the gut, magical $100 probiotics, and all these things. And then I ask people after a couple months, I'm like, so how you doing? And they're like, I don't feel any different. They've restricted all these foods, taking all these supplements, and they're like, I don't feel much of anything better. If anything, they feel worse because there's probably nothing left for them to eat. And they're not on any magnesium the whole time. So back to that story about the client, she thought it was so humorous that I was talking about all this magnesium, because she says, you know what my dad does for a living? And I said, well, no. What? He saves dying palm trees. Like, so if somebody has a palm tree that's dying, he goes in, he's the doctor who saves it. And she said, you know what his main tool is? And I was waiting for the punchline. I'm like, no, what? And she said, Epsom salts, magnesium sulfate.
Uh-huh.
Saves palm trees from dying by using magnesium. So magnesium isn't the fix for everything, but what I'm getting at is the soil in the garden. I did a post on iron, actually. Eric, I'm sure you saw this post the other day.
Yep.
I did a post, I found about how iron overload in the gut affects the gut bacteria, the biome that everybody likes to talk about. Too much iron lowered the good bacteria and increased potentially pathogenic bacteria. So if somebody had iron overload and they never knew about it, and their iron status is continually getting worse and their gut's continually getting worse and nobody's dealing with it and nobody's changing their diet, maybe they're getting put on a ketogenic diet because the person they're reading on the internet or their practitioner thinks carbs are the creator of all evil, which they're not. And And so they're eating tons and tons of meat, and they're making themselves worse. Do you see where this is going?
Absolutely.
And then they're not putting any magnesium in the first place to help that part of the soil, but the main cause for that person might be iron. So these things, I get into the minerals because anybody who knows anything about gardening knows that if you want a good garden, or if let's say something's not growing in your garden that you want it to grow, and you're doing everything right, it's because the mineral balance of the soil is probably wrong. And we have to fix the mineral balance of the soil. So if you think of your gut as your gut intestine, the actual tissue is the soil. And then the bacteria grows on the soil. Think of the plants in the garden as the bacteria, the biome.
Mm-hmm.
Well, we have to make sure that the gut has the right minerals in it so it can grow the right things, and so it doesn't have too much of the wrong minerals, like the iron post I made on Facebook the other day. So I just love this one because, I see people's gut issues get better with magnesium. So let's think about this. So we have a person with gut problems, and they have intestinal permeability, let's say, because they have a massive magnesium deficiency. So too much of the wrong stuff is getting in, but they probably also have an absorption problem, so not enough of the right things are getting in. This is one reason I love topical magnesium so much, is because we completely bypass the gut problem.
Works so much better.
Right. Topical is working. Eric and I have been talking about all the things that are working really well topically. He's been exploring even more things in the curcumin, turmeric topically, and some other things. I told you about this, Eric, right? I told you about my magnesium Magahol. So Magahol is a mixture of magnesium chloride and alcohol, and I made that into a cream, and I added turmeric essential oil to it. So it's pretty cool. It smells a lot like turmeric. If you know what turmeric smells like, I mean, it smells like turmeric. It smells like a root. But actually, I've been, with my gymnastics type strength training, my elbows have been a little tender lately, and I put that on there, and it seems to really calm it down, both the magnesium and the turmeric. So I don't know which one it is.
It's a great combo. Before, when I go out to a run, or when I get back from a long run, that's exactly my combination. Is I'll put magnesium and turmeric together, and it's magic.
Great minds, right?
Yeah.
So anyway, so this is one of my favorite studies. I always go back to this one whenever people are spending tons of money on gut healing protocols. Is the thing that everybody's making bone broth all day and I just go, bone broth would probably be really rich in calcium, which may not be the thing for the person. It's also really high in arginine, which can stimulate herpes viruses to replicate a lot. Epstein-Barr monovirus, that's a herpes virus if you didn't know, so they may be aggravating their chronic fatigue with all this collagen. So anyway, let me go to the next study. Oh, this one is by far one of my favorites. Oh, let me clear off all that stuff. Hypercalcemia and metastatic calcification. It sounds kind of boring, but
really important.
When we get down to notice those keywords right there: vitamin D toxicity, right there, and calcinosis, dysfunctional calcium, too much. Let's go down here. So this guy starts talking about the discovery of vitamin D. Okay, let's talk about vitamin D real quick. I'm probably going to have to do a whole show on vitamin D at some point here. I've already done one with the 180radio.com, but I've learned a lot in the 3 or 4 years since I did that one. Okay, vitamin D. The biggest thing you want to ever remember about vitamin D, particularly supplements, is that their main function in the body is to raise calcium in the blood. How does it do this? It increases your absorption of calcium from the diet, which is, Eric will get into with iron overload problems. A lot of the problem with that is that those people are absorbing way more iron from their diet. So it's a similar problem to when people take vitamin D supplements. They absorb way more calcium from their diet. But here's the part that nobody talks about. Vitamin D increases calcium resorption, somebody might want to say reabsorption, from the bone. Vitamin D supplements will pull calcium out of bones into the blood to increase the calcium in the blood. Don't believe me? That's cool. Go and Google vitamin D bone resorption. You don't have to believe me. You can believe the endocrinology textbooks out there. This is what it does. So everybody's taking all this vitamin D to prevent osteoporosis. Might they actually be causing their own osteoporosis with all of this stuff? Yes. Then they take, so here's the problem, they take vitamin D, which increases their calcium absorption from their gut and resorption from the bone, and then they add calcium supplements to it. They throw gasoline on the fire. This is like, I'm going to tell you right now, taking calcium supplements and taking vitamin D supplements at the same time is a quick way to a heart attack. But the Viking protocol is what I wanted to talk about this. The Viking protocol was where people back when, so first there's already been a vitamin D fad before. There was a vitamin D fad when vitamin D2 or ergocalciferol, which in the natural state is what comes out of plant foods like mushrooms. Mushrooms have vitamin D2 in them, but they started making it into pills. And most of the stuff that people get from the pharmacy, if they get prescription vitamin D, is vitamin D2. But there was a fad before where everybody started taking vitamin D2. And then there was something called the Viking protocol, which was where people were taking cod liver oil and vitamin D2 and tons of milk. This is a calcium disaster waiting to happen. But let's talk about.
This kind of sounds like a CrossFit workout too.
Oh gosh, the effects of overdosage of vitamin D2. So back when the fad hit before. Within 4 years of high dose ergocalciferol being released for sale. So the non-specific ones of hypercalcemia, nausea, vomiting, weight loss, colic. Let's go into the more common ones. Constipation. How many people out there are constipated? Thirsty. People drinking tons of water. Oh, well, thirst leads to drinking tons of water, peeing tons, headache, weakness, apathy, depression. Got thyroid problems, been taking a lot of vitamin D. Depression and anxiety are two sides of the same coin. Apathy, well, I've never seen a high energy apathetic person, right? Depression and fatigue go hand in hand because I look at depression as fatigue of the brain. Mm-hmm. So they found, where was Mrs. T? Wait, let's go over this too. When you take vitamin D and you wonder why your levels don't rise for so long, vitamin D is stored in your fat tissues. So when you're taking vitamin D supplements, and let's say your body doesn't want it, what's it going to do? It's got to get, vitamin D is trying to raise the calcium in your blood. Your body has to keep the calcium level in the blood very, very stable, or else very quickly you could get symptoms. Your heart can go crazy, your brain can swell. You need to keep your calcium within a very tight range. Very simple. That's why blood tests for minerals are not very useful. Vitamin D supplements trying to raise the calcium in your blood. That's what they do. So your body says, this can't happen. I have to get this vitamin D out of here. Where can I put it? Well, it could try to detox it through your pee and your poop and your sweat, but the much faster way is to just shove it into your fat stores. It will do this until you run out of room in your fat stores. So you can't store any vitamin D in there at all. Here's a study that confirms that. I was on Subversity the other day. A study showed that obese people, it takes a lot longer to raise their vitamin D levels in the blood. Well, why is that? They have a lot more fat to store in. It makes sense. Mm-hmm. So they're storing the vitamin D in their fat tissues, and this is why it takes, I'm going to tell you before you take a whole bunch of vitamin D, it takes me a year or more to get these fat stores to completely empty of the vitamin D that is ruining people's lives through the high calcium. So, let me see, I need to find the Viking protocol in here. The prevalence, wait, let's go here. Anybody with rheumatoid arthritis, the prevalence was much higher when vitamin D was given for rheumatoid arthritis. Extensive calcification, any of you with osteoarthritis out there? Calcification of ligaments and tendons, so calcium in these, and within joints often accompanying tumoral deposits. So, gosh, where's the one I want? Anyway, so they talk about this. So you people who are into the Weston Price idea and stuff like this, and so you're drinking all the raw milk. Well, first let's talk about raw milk, or milk in general, dairy milk, cow milk. Human milk has 4 times less calcium than cow milk, and human milk is very, very low in vitamin D. So human milk, what is designed for us, has almost no vitamin D in it and 4 times less calcium than cow milk. Cow milk has vitamin D in it, and it has 4 times more calcium. If your logic centers can't look at that and go, well, what's designed for humans and what is possibly not good for us, I can't help you much more than that. So adult humans don't need a ton of calcium. We just don't need it. We're actually very good at recycling and reusing and repurposing the calcium we already have. We do not need dairy for calcium. Dairy is a whole big other argument, but if people want to talk about the calcium part of the argument, I'm going to say people do not need dairy for calcium. And your babies and your children do not need vitamin D. Get them out in the sun and get them playing and get them magnesium and they'll be fine. But anyway, they talk about in this paper, the Viking protocol, where it was lots of raw milk, cod liver oil, which has lots of vitamin D in it, a little bit of vitamin A, but it's not enough vitamin A to counter the vitamin D. Anybody who tells you that cod liver oil has the perfect amount of vitamin A and vitamin D, perfect ratio, I say to them, the only thing it's a perfect ratio for is for the cod, okay? Whoever came up with the perfect ratio, I don't know, because on hair tests, I can guarantee I can tell you who took cod liver oil and who didn't. To give you an idea of what 5 years of taking cod liver oil can do to a person, I have my highest calcium client ever. We want calcium on a hair test of about a 40. My client who took 5 years worth of cod liver oil, her calcium was at a 700, okay? So cod liver oil is messing people up. Besides the fact that the fermented stuff is rotten and oxidized and ruining your health that way, it will raise your calcium. It will suppress your thyroid because that's what high calcium does. It will cause your blood sugar issues. It will lower your potassium and cause all sorts of problems because of that. Not a fan of cod liver oil. The stuff that has vitamin D in it, I do actually use vitamin A derived from fish liver oil, but it has all the vitamin D removed. This is very important. But the Viking protocol, this woman, I'm not going to keep scrolling through this article to find it, but this woman who had hypercalcemia and she went to the hospital for this. So that's how bad it messed her up. She was going to the hospital. It took, so she was not on my program, or we could have fixed this a lot faster. So just for her blood to get back into the normal range for calcium, it took a year for her calcium to return to the normal range. And I'm sure they just told her, they're like, well, don't take vitamin D, don't take cod liver oil. I'm sure, I don't know what they told her about the raw milk. They probably said it's probably a good idea if you don't eat raw milk for a while. But yeah, it took her a year for that calcium to come down. And I'm going to tell you that even after that year, she probably still had residual health problems from that vitamin D that was stored in her fat tissues for probably the rest of her life. I see people, I have people who tell me I stopped taking vitamin D 5 years ago, and I get their hair test and I'm like, you still got high calcium. It didn't just go away. The fat-soluble vitamins are the most powerful things that we can take. People like to talk about vitamin D like it's a hormone. And they say it's a hormone. It's not really a vitamin. It's way more powerful than a vitamin. And I go, okay, so you're just randomly taking hormones at whatever dose you see fit, and you're possibly getting worse. If people actually pay attention, they often know the time they got worse when they were taking vitamin D. It was a very drastic thing. And often it coincides with when their blood test vitamin D finally started coming up because their fat tissues were saturated. The vitamin D had nowhere else to go, so it had to stay in the blood, so it starts raising calcium, and there's no escape for it. And that's when people will tell me, oh, that's when my doctor had to raise my thyroid hormone. Oh, that's when I started feeling terrible, and I finally decided that taking this vitamin D was not good for me. And this is a great article to read. If you think that vitamin D is just the most wonderful thing and everybody needs it, well, first of all, you always have to look at where vitamin D studies were done. Were they done in a sunny area or were they done in a cloudy area? And you just need to look at, they talk about here, when they talk about the Viking protocol, like they were fantasizing or fetishizing the Vikings taking cod liver oil. Like it's the most wonderful thing. And they miscalculated the dose response curve of cod liver oil. A teaspoon would have been a better implement than their ladle. or Mrs. T's tablespoon. In view of their formidable achievements, it's likely that the Vikings escaped the worst effects of vitamin D intoxication by irregular dosage and non-compliance. So they weren't taking it regularly. When was this written? 97. This was before the recent vitamin D fad. It's like the cholesterol research. The cholesterol research that came about before statins, most of it tended to point towards low cholesterol being the worst thing you could have. As soon as the statins came around, they decided that cholesterol was bad and we need to lower it. Now all of a sudden high cholesterol is the big problem. And I've seen doctors happy with people's total cholesterol at a 110, and I'm like, you're going to kill that person.
And I saw a guy get down to 97, and not coincidentally got prostate cancer several months later.
Jeez, these
97.
Yeah. Let me just kind of close with this about the vitamin D thing. If you ever talk to somebody who says everybody needs vitamin D, or that I saw this on the internet the other day, you can't take too much vitamin D.
Ooh. Yeesh.
You can take too much of anything. You can drink water to yourself. You know, you can drink yourself to death with water. So anybody who ever says you can't do too much, really you should just turn around and walk out, or click off that website. And if people don't understand, so when I see somebody, vitamin D is supposed to be made from sunlight. So when I see somebody who's like, let's say in Portland, Oregon, and I see a low calcium level on their hair test, sunlight can be an issue in their vitamin D production. But I can tell you, when I see people who come to me and they tell me they have low vitamin D levels and they live in Tucson, Arizona, which is where I'm at, they don't have a lack of sun for the most part. They have other issues causing their vitamin D problems. And if you don't realize that the rise in calcium in your tissues, so just like Eric and I are talking about, it's like the rise of iron in the tissues. The rise of iron can be shown a bit through ferritin, sometimes, not always, but sometimes through ferritin. The rise of calcium in the tissues doesn't show up on blood tests. It only shows up on a hair test. And so if you don't know where to look for these problems accumulating, they're just going to happen, and they're going to continue slow burning away your health. And most people aren't going to know where to look for them. The biggest supplement travesty is going to be when the world finally realizes that vitamin D is killing them, the supplements. I'm a big fan of good vitamin D levels. I only think they need to be between 26 and 40. I'm not at the 50 or 70 or 100 or crazy stuff that like other doctors are putting out there that no one could ever get to naturally. We need to figure out what the good vitamin D levels are only after magnesium has been dealt with. And actually, Eric, I've been sending you some research. We've been talking about this. It seems that the liver can be heavily affected by iron, which then affects vitamin D production.
Absolutely.
So we start talking about, Eric and I are big on, Eric's getting the iron down. I'm like especially, Eric's into magnesium too, but I'm really into magnesium. And magnesium's been shown to raise vitamin D. If we can fix the iron overload in the liver, that'll help fix vitamin D levels. And then all these things fixed, and then we start seeing there's no problem with their vitamin D. So anyway, those were my two studies. Anything you want to add to that, Eric?
Well, it just sounds like vitamin D is more the effect rather than the cause. In other words, like, when you see a number on a lab test and you say, aha, we can do something about this. You have low vitamin D. Vitamin D is important. Let's raise your vitamin D. Let's give you 50,000 units of D2 and come back in a year.
Right.
And in the meanwhile, they just take that advice. We see people all the time taking 5, 10, 15, 20,000 units of D3 a day. And like you're saying, the levels in the blood don't necessarily come up even on those massively high levels, but a lot of people sure do start to express symptoms from that.
Yeah. Well, I've heard of 300,000 unit vitamin D injections now.
We saw that the other day with one of my wife's patients, yeah.
And the problem with vitamin D is the more you put in all at once, the bigger problems it's going to throw, the bigger wrenches it's going to throw into the system. Actually, let me add one thing to that about vitamin D levels and how people think that if they just raise their vitamin D levels, health will magically find them. So it's like when we look at studies on people will say, oh, vitamin D and colon cancer. Vitamin D is good for colon cancer. Well, most of the studies on that were, so they find a bunch of people who have just been diagnosed with colon cancer, and they test them for vitamin D at the start when they were diagnosed. And what they find, a common thing, they'll say the people with higher vitamin D levels at their diagnosis lived longer than the people with lower levels. So they were just measuring their normal, off the street, not supplemented vitamin D levels. They said the people who had higher vitamin D levels lived longer. Okay, here's what I'm going to say as an alternative theory. The people who had higher vitamin D levels, I mean, we're talking about colon cancer people, so this is not, these are not healthy people. But relatively, the people with higher vitamin D levels were overall, quote, big quotes here, big air quotes, healthier. They were healthier than the people who had lower vitamin D levels. They might have had more magnesium in their system. They might have had less iron overload. They might have had all sorts of things that affected their vitamin D levels. And so what people are doing with these studies, these kind of like observational studies, not interventional, not where they do something to people, but these observational studies on vitamin D, is they're making the assumption, I'm going to use that word a lot, because when you assume, you make an ass out of you and me, right? So they assume that if you take vitamin D and you raise your levels, you somehow gain the better health.
Right.
And it doesn't work that way. What I'm saying is that a sicker person has lower vitamin D levels as a result of what they're doing, not a cause of what they're doing. Now, if somebody never went outside and they have low vitamin D because of that, then they need to go outside. This is what people need to realize. Like, you don't get to be healthy without moving your body. You don't get to be healthy without going out in the sun. You don't get to be healthy without eating fruits and vegetables. Like, there's certain things that humans just have to do, right?
The basics,
the basics. And so if people refuse to do those things and then they want a Band-Aid, like they never go outside and they play video games indoors all day and they eat Cheetos, and then they see that their vitamin D levels are low, taking vitamin D is not going to fix that, and it may actually make things very, very much worse. Low vitamin D levels, I've actually come to the theory, sometimes it may actually be protective so that you don't calcify into a statue where you're standing. But anyway, I could go on. We'll do a whole calcium show. I'm sure we'll do a whole iron overload show when we go. But yeah, this study, hypercalcemia and metastatic calcification, this is a great one to read. I send this to people who are all like in love with taking vitamin D and they think there can't be problems from it. And yeah, it's just, you cannot mess around with hormones. Like, people wouldn't just go and randomly take, well, actually some people do, they just take hormones. They, we've got the Ray Peat people out there taking the thyroid and progesterone and just dosing themselves based on how they feel. We got the anabolic steroid users just dosing themselves. At least those guys actually do tend to run labs sometimes, but people are going out there messing with hormones, and they know, usually when somebody's messing with hormones, they understand that it's kind of serious. Vitamin D, if we want to consider it more of a hormone than a vitamin, if you go playing with it, you're playing with fire. And you just may be aging yourself more quickly, because one of the factors of aging that we look at is kind of those stiffness in the joints and the osteoporosis, osteopenia, bone loss, and calcium accumulation. Heart disease is a calcium accumulation disease, but we were talking about they're finding iron in the plaque, to the point that they could even diagnose the plaques with a CT scan that looked for iron. So it seems that there's calcium in the plaque and there's iron in the plaque. Chicken or the egg? I don't know. But if we can work on both of them, well, we could fix the whole problem, would be the theory.
There are so many overlaps between the two.
So that's about all I have. We should get to probably wrapping this stuff up, because we've been on about an hour and a half now, I think. So what we were going to talk about, anything else you want to add before we go?
No, I think this is a good way to kick it off.
Okay, well, so this has been Dr. Garrett Smith and Dr. Eric Lewis of Cafe Gray. Next episode, we're going to be talking about all the problems that excessive calcium and excessive iron or iron overload can cause in the system, and how our theories on how we as a society, especially Western society, have kind of gotten ourselves to this point. which is partially due to some of the problems of the past that we've been trying to fix. And now we've kind of over-fixed them, as we tend to do in the West. So
we're always overshooting things.
Yeah, so anyway, it was great having you guys here with us today, and we will hope to see you back for another episode of Cafe Gray in the future.